The concept of oral debridement. There are four considerations on that. One is effective brushing. The second is interdental cleansing. The third is the use of a bactericidal mouthwash. And the fourth is on tongue debridement. So let's talk about some thoughts on teaching effective brushing. These thoughts will help the patient understand what they're trying to accomplish and make brushing more effective. And second, it'll prevent recession and/or root abrasion. The two biggest mistakes in ordinary brushing, in my opinion, are using too much toothpaste. And you'll see on the left where the bristles have all been covered by a gel, and on the right, the little dollop of tooth gel, which is certainly adequate. The second is using toothpaste rather than a tooth gel, because I think from an abrasion standpoint, long term, you'll get less recession with a gel than you will with a paste. To make brushing more effective, we need to be very deliberate and focused on what we're trying to do. But what do most people do when they're brushing? They're brushing in the morning and they're thinking about what they have to do. They pay no attention to what they're doing. But one of the things that I'm going to emphasize is when I started changing my brushing habits to what I'm going to show you today, I started verbalizing in my own mind like I was teaching someone how to do it, and that kept me much more focused. Preventing recession and root abrasion. As I said earlier, toothpaste versus a tooth gel. And we're going to talk about cervical erosion and cervical corrosion. Erosion is with water, corrosion is with some chemical, and a paste is a milling paste, and therefore, if you do get recession, you can actually wear away further tooth structure using a paste. A little aside on this, for those of you that are interested in saving a few dollars, making a tube of toothpaste or gel lasts longer. You can see here that we've used up a tube of tooth gel where we ordinarily throw it away. But if you'll suck on that and just get a dollop on your tongue, you can sometimes get a couple of 3 weeks more tooth gel out of that. Just a little aside, not anything really significant. Toothbrush design. Here are two toothbrushes that are made by the same manufacturer, totally different design. So the design really makes no difference as long as you use a non-abrasive soft brush. But what about electric toothbrushes or battery operated or mechanical toothbrushes? Actually, these I think are good because virtually all of them have soft bristle brushes, and whether they use a vertical stroke or a circular stroke really doesn't make any difference. And for patients who don't concentrate or focus as I've suggested, perhaps the stroke would make a difference and they may be more effective. Now let's go to the video demonstrating brushing technique. Now let's talk about the brushing technique. And here are the two toothbrushes that you saw in the other video, and we're going to select this particular one to use today. And remember, we're going to talk about using a gel, and remember we talked about just using a dollop of toothpaste. And one of the things that I personally do is just squeeze that dollop out on my tongue. And my wife has her own tube of toothpaste or tooth gel, and I use this one. You will notice that my mouth is dry, the toothbrush is dry, because as we begin brushing, we're going to stimulate saliva. And as we brush, as I mentioned earlier, I'm going to go through in my own mind as if I were teaching someone to brush to keep me focused on what I'm doing. Remember what I said. The first thing we want to do is you should be able to talk while you're brushing, because the stimulation of the mechanical stimulation in the mouth is going to produce all the saliva that you want. And we're going to start behind or the distal to an upper 12-year molar or first molar, and we're going to come around to the facial, and then we're going to come on the other molar back here, then we're going to do the lingual. So now with the paste in my mouth, I start on the upper second molar. It's a rotary circular stroke. And I'm coming around to the facial. And notice I could talk. Now I'm on the distal to second molar, focusing right at the gingival margin. And I'm using a gel. I'm using a stroke that will not cause recession, or if recession is present, will not cause abrasion on the root. On the palatal or the lingual approach, after watching a couple of videos on this, I'm now advocating a vertical stroke and coming back there. And notice I'm going to expectorate. That is the saliva that I've created. Now, I'm behind that second molar. And usually I come around a couple of times. Then I come in and notice the toothbrush handle is pointing up. And I expectorate again. And notice that I have now done a thorough job of cleaning, and my teeth feel just as slick as they can be. So to repeat what we said, number one, a minimal amount of tooth gel. Number two, on a dry brush because it's going to create saliva. Number three, you should be able to talk while you're doing this. Number four, mentally in your mind to keep you focused, I mentally think about I'm teaching someone how to brush. If you will do this, you will find that your brushing will be very effective, and certainly if you want to use a mechanical toothbrush, it has the proper stroke, and for the patient who doesn't focus as well, perhaps a mechanical toothbrush is the way to go.